Hi, and welcome back to yet another episode of House of Wellness. Every year, May 17th is observed as World Hypertension Day. Basically, it is to create awareness about hypertension, its prevention, detection, and control. हम सबको पता है कि hypertension मतलब high blood pressure.
Okay, it gives me great pleasure in welcoming Dr. Anisha Siyal. She is a consultant intensivist and has clinical experience at Cloud Physicians, Bangalore. She has a lot of letters in front of her, so I'll just go through it. She's MBBS, MD Anesthesia, IDCCM, IFFCM, EDIC, MRCP, Clinical Fellowship in Neurocritical Care and Trauma. Welcome, doctor.
Thank you.
Hello, doctor. Welcome to our show. So, मेरा पहला सवाल आपसे है कि हाइपरटेंशन क्या होता है, क्या आप एक्सप्लेन कर सकेंगे?
So, in simple ways, our heart is beating. It is contracting, isn't it? हर एक धड़कन के साथ heart खुलता है और बंद होता है. So when it is contracting, it is called systole, and when it is relaxing, it's called diastole. And this happens at a pressure. So that is nothing but blood pressure. So when it's contracting, it's called a systolic blood pressure. When it is relaxing, it's called as diastolic blood pressure. And basically, this pressure helps in keeping the circulation of blood throughout our body. So that is what is normal blood pressure. When it exceeds जो normal limit होना चाहिए, जब वो उससे ऊपर चला जाता है, तब वो hypertension होता है, जो शरीर के लिए अच्छा नहीं है, which is not a good thing to have.
Okay. So then my next question would be that why is it called a silent killer?
You know, 1 in every 3 people in India have hypertension, and almost 47% in the West have hypertension. So it's like हर 2 इंसान में अगर आप देखेंगे तो एक इंसान को डायबिटीज है, और इंडिया में हर 3 इंसान को अगर आप देखेंगे तो you know there is 1 person who has hypertension, and अधिकतर इन लोगों को पता भी नहीं है कि उनको hypertension है. So that is why it's a silent killer. It's there in you, but you don't even know it's there in you. And it's slowly damaging all your organs without your awareness. क्योंकि अधिकतर hypertension में symptoms नहीं होते हैं. Majority of the patients may not display any symptoms. A small proportion may come to the hospital with symptoms and they get diagnosed. So until unless you do a lot of screening, a lot of patients may not even get picked up that they have this disorder or they have this disease. That is why it's a silent killer. It's slowly there. It's taking over your organs, but you don't even know you have it.
Okay. Doctor, आपने कहा कि it harms various organs. Can you elaborate on that, please?
See, क्या होता है जब कहीं भी pressure normal से ज़्यादा होएगा, and it keeps running with that sort of force and pressure, it will damage every part, isn't it? So we have blood flowing through our entire body, our brain, our eyes, our heart, our lungs, our kidneys, everywhere. So what happens is when you have these high pressures for a long period of time, starting from head to toe, it can lead to strokes. It can cause eye damage. It can cause retinopathy. It can lead to cardiovascular problems, like it can lead to heart attack. It can lead to weakening of the heart functions. It can damage the kidneys. These are just some of the damages that high blood pressure can do.
Okay. So how can we prevent this? And if detected, how do we manage this?
Okay. So the first most important is to understand कि ये blood pressure क्यों है. 90% कोई कारण नहीं होता है जिस वजह से हाइपरटेंशन होता है. इट कुड जस्ट बी लाइफस्टाइल इश्यूज, जैसे आप स्मोकिंग करते हो, अल्कोहल है, हाई सॉल्ट डाइट है, एंड योर ईटिंग हैबिट्स आर नॉट गुड, यू हैव वेरी हाई कोलेस्ट्रॉल इन योर बॉडी, डिस्लिपिडीमिया. दीज ऑल थिंग्स कैन लीड टू यू नो hypertension. And the simple thing is to take care of these things. 10% of the population have underlying medical disorder, like they may be on medications, they could have kidney problems which lead to hypertension as a collateral damage, or as a consequence of that disease. So in these cases we need to target the condition which is leading to hypertension. जैसे अगर किसी को किडनी की बीमारी है जिस वजह से उनका ब्लड प्रेशर हाई जा रहा है, तो हम लोगों को पहले किडनी का ट्रीटमेंट करना पड़ेगा कि why this is not functioning well, and at the same time we give blood pressure medications to decrease the blood pressure. सो द इम्पॉर्टेंट थिंग इज कि आप योगा कीजिए, हेल्दी डाइट कीजिए, जो आप डाइट खाते हो उसमें आपका सॉल्ट कंटेंट कम होना चाहिए. व्हेन आई से सॉल्ट कंटेंट शुड बी कम, इट डज नॉट मीन दैट यू स्टॉप एडिंग सॉल्ट एट ऑल टू योर डाइट. It is just that you eat in normal quantities. The food that has high salt content like pickles, papads, avoid those sort of things. Exercise daily. Take less stress, be more calm, do breathing exercises, do yoga. All these things have long-term benefit in managing your blood pressure. Have, a daily 30 minutes of walk or exercise, it can do wonders to your body. Managing your weight is one of the important things to control your blood pressure.
Right. डॉक्टर, आजकल हम काफी सुनते हैं कि बिफोर स्टार्टिंग एनी मेडिकेशन फॉर हाई ब्लड प्रेशर कुछ टेस्ट आता है 24 आवर्स ब्लड प्रेशर मॉनिटरिंग. हाउ इम्पोर्टेंट इज दैट? वन पार्ट बी ऑफ दिस क्वेश्चन इज, मैं ये काफी सुनती हूँ व्हाइट कॉलर ब्लड प्रेशर,
व्हाइट कोट हाइपरटेंशन. सो आई एम ग्लैड यू आस्क्ड दिस क्वेश्चन. क्या होता है ना, अधिकतर जब हम लोग हॉस्पिटल का नाम सुनते हैं तो हम लोग घबराते हैं, डरते हैं कि क्या होने वाला है. So the minute you get into a hospital environment, you're worried and you're anxious. So a lot of patients, when they come to the hospital and उनका जब blood pressure checkup होता है तो blood pressure high दिखाता है. Okay, so that is called as white coat hypertension, where आपके घर में अगर आप blood pressure check करेंगे तो वो normal रहेगा, पर जब आप कोई डॉक्टर के सामने हो, कोई मेडिकल प्रोफेशनल के सामने हो, या आप हॉस्पिटल के एनवायरनमेंट में हो, तो आपके एंजाइटी के कारण, स्ट्रेस के कारण आपका ब्लड प्रेशर बढ़ जाता है. So the best thing to do is, if you identify that the patient has a lot of anxiety or even otherwise, it's a good idea to have a 24-hour ambulatory blood pressure monitoring. This is a very simple test. इसमें छोटा सा मशीन होता है जो blood pressure आपका measure करता है through 24 hours. It's like a BP cuff आपके हाथ में लगा रहेगा, छोटा सा machine on a sling, it will be given to you. And ये आपका blood pressure check करता है multiple times in the day at various times. And फिर ये जो मशीन है वो आप वापस रिटर्न करते हैं डॉक्टर्स को, and they take all the data from this. And they see all the values कि पूरे दिन में आपका ब्लड प्रेशर कैसा रहा है, कब आपका फ्लक्चुएशन हो रहा है, कब आपका इंक्रीज हो रहा है, डिक्रीज हो रहा है, या मोर और लेस पूरा दिन ठीक रहता है, एक पर्टिकुलर टाइम पे आपका बढ़ता है. तो ये ज्यादा डेटा आपका देता है, एंड इट टेक्स अवे एनी कंफाउंडिंग फैक्टर्स लाइक एंजाइटी हो गया, हॉस्पिटल एनवायरनमेंट हो गया, ये सब चीजें नहीं होती है. सो इट्स अ बेटर वे टू असेस वेदर अ पेशेंट रियली रिक्वायर्स ट्रीटमेंट, वेदर द पेशेंट रियली रिक्वायर्स टू गो ऑन टू मेडिकेशन, एंड इट इज नॉट जस्ट एंजाइटी और things like that.
Understood.
Does that
So,
answer your question?
yes, definitely. Yeah. So हमने हाइपरटेंशन के बारे में आपने इतना सारा बताया, लेकिन पता कैसे चले किसी को कि they have hypertension? So what are the symptoms that they should be looking out for, and then what are the tests that should be done so that that helps in detection?
So majority of the patients may not have any symptoms. That's why we said it's a silent killer. They may not experience anything, but a few of them may just have some sort of heaviness in their head, some amount of giddiness, or feeling tired, feeling weak. They may get some swelling of their hands and legs, or they start having bleeding from the nose, or they may have bleeding from the urine. Sometimes if it's extremely high, they may land up coming to the hospital with complications such as stroke or a heart attack or a kidney failure, and then you realize that the patient had hypertension. So the symptoms can be from no symptoms at all to very drastic and terrifying symptoms. The spectrum is very large. The simple things that one can do is to do some, like if you have risk factors, then you should periodically check yourself, like every 6 months, get yourself tested, see if your blood pressure is normal. So this is for people who have kidney disease, who are on medications where your blood pressure can go up. But those people who don't have any medical disease, they are just completely healthy individuals, maybe a yearly checkup for them, just making sure that they check the blood pressure, that it's okay. Get something called RFT, renal function test, doing their serum creatinine, having an ECG. These help in assessing whether the patient has any effects of blood pressure, or whether the patient has potential to get high blood pressure.
Okay.
And once the patient gets admitted, then, the entire battery of tests is done, like lipid profile. Cholesterol is one of the causes that can lead to hypertension, isn't it? So just having a check on your lipid profile and seeing that your cholesterol is not very high, that is also a useful thing to kind of, manage your progress.
Right. So, doctor, you have answered all our questions today, and it has been so easy to understand. इतनी आपने सरलता से explain कर दिया. तो मैं सब seniors, whoever's watching us, please request करती हूँ that at least once in 6 months आप उनका blood pressure check करवा दीजिए. Thank you, doctor, for your valuable guidance and your
Thank
time.
you for having me. Thank you.
Thank you, doctor. That was very,
Thank you.
very informational. And cheers to wellness.
Cheers to wellness.
Thank you.